Hey, everybody, welcome to That Expert Show, where you help run the show. I'm Anna Canzano. Thanks so much for being with us today. Our topic today is naturopathic medicine. I have so many questions about this field. I have friends who are just completely sold out on the idea of this being better than traditional Western medicine. And I would just love to know some of the evidence, the facts, the science behind naturopathic medicine and what its benefits and what its limitations are. Our expert is a fantastic resource on this topic. She was actually the first woman ever licensed to be a naturopathic physician in the state of California. You might have seen her on the TV show The Doctors. She is author of the best-selling book Clean Skin from Within, and she hosts her own podcast as well. Dr. Trevor Cates joins us right now from Park City, Utah. Dr. Cates, thanks so much for being with us.
Thank you. It's great to be here.
Let's begin with just an explanation of what it means to be a naturopathic doctor, because as I have explored this in the past, I've been reluctant to go down the path of naturopathic medicine myself, because I didn't want to just buy things over the counter that I didn't know, what they would do and the dosing amounts. I wanted to have guidance from someone who had actually studied this and was licensed in it. Can you help us understand the difference between a naturopathic doctor and a conventional doctor in terms of the training and the expertise that comes with it?
Yeah, absolutely. So licensed naturopathic physicians such as myself go through rigorous training to become licensable naturopathic physicians. So we attend a 4-year medical school that's similar to, a lot of coursework is similar to conventional medical school, anatomy, physiology, pathology, those sorts of coursework, but we also get training in herbal medicine, environmental medicine, homeopathic, nutrition, and those sorts of what oftentimes are considered complementary alternative medicine techniques. And it's all taught within the 4-year naturopathic medical training. And really the understanding, there are certain core principles and philosophies of naturopathic medicine that we believe that the body is really wise and it needs certain tools to help get it in a state of balance. And so using things like nutrition and healthy lifestyle can help restore the body and get it back into a healthy state. And we are trained to prescribe medications when necessary, but we will really believe in using the least invasive medicine first to help support the body's innate wisdom to heal. And so that's when we go back to healthy lifestyle and what we're eating, stress management, exercise, those things that are so key and important. And then also supplementing and helping support the body, giving it a little extra encouragement with things like nutritional supplements, herbal supplements, physical medicine techniques, and those sorts of modalities to help restore the body and its innate wisdom.
I think sometimes your field faces skepticism, maybe a little bit of criticism from people who don't understand it or have some doubts about the science behind the medicine that you practice. What can you say about that? Because, obviously pharmaceutical companies pay a lot of money for the research in the drugs that they dispense and that conventional doctors prescribe. What can you say to people who are doubtful about this field?
Well, we do go through rigorous training, and there is definitely science behind naturopathic medicine and what we do. And research is constantly unfolding and helping support some of the philosophies and the modalities and treatments that naturopathic medicine has been talking about for many years. For example, there's a lot of research that's been coming out about the gut-brain connection, the gut-skin connection, and the importance of the gut microbiome in so much of our overall health. And the research is showing this. And yeah, it's something that naturopathic physicians have been talking about for many, many years. And it's always great to see the research lining up with what we've been doing throughout time. And, I think when we think about truly what science is and understanding what works and what doesn't, is understanding how the body works. And when you really truly understand the anatomy and physiology of the body, we go back to that and we think of how the body works and we support that rather than always trying to come up with a quick intervention that actually can disrupt the way that our body works. So, for example, antibiotics are a fantastic tool when we have a bacterial infection, but we really need to be careful about overuse of antibiotics. And of course, this is clearly shown in the research, and doctors are being much more mindful now about antibiotic use and realizing that it has led to overuse, has led to super infections and actual disruption of the gut microbiome, which has led to other health problems. And so, it's always great to support the body and using science and medicine in a mindful way, and definitely looking at research. I mean, naturopathic physicians were, whenever I go to conferences, we're always digging into the research. We want to see the research that supports what we're doing, the supplements that we're recommending, any kind of treatments that we do. We always look for that research, and there is so much there. And I'm always surprised to hear people say that the research doesn't support naturopathic medicine, because all you have to do is to go onto a site like PubMed, which is a database of research articles, and search something like vitamin C or whatever it is that you're looking for, probiotics, and see all the positive research that supports using nutrition to support the body. And I think so often we get away from realizing how the body works and thinking about that first, and using medications when they're necessary. And when we use, for example, I mentioned antibiotics, when we use them when they truly are medically necessary, then they work so much better, and they can be a powerful tool, and they can save lives. And so, but there's also a lot we can do with the foods that we eat, with mindfulness and meditation and exercise and supplements to help support the body, so we don't need to overuse medications. We don't need to jump into surgery before necessary. And we have those tools when we need them, but let's not overuse it. Let's not abuse it. Let's support our body. So, because we are living longer, and we want to have the quality of life that in those many years to come, we want to have that quality of life. We want to look and feel our best. And naturopathic medicine helps support that, helps support and ensure that you have that quality of life that you want to have. And the other great thing about natural medicine is it's much less likely to come with side effects. And so when we look at food as medicine, then we're not going to have the side effects. And naturopathic medicine in general, we pay lower amounts in malpractice because there are less claims and less issues that come up with naturopathic medical practices. There's just less risk associated with this type of medicine. So people can get the support that they need to have optimally healthy, long lives without the concerns of a lot of the side effects that come with conventional medicine. And I'm not saying that you have to choose between one or the other. I mean, ultimately, we have, especially if you're in a state of ill health, then you have a team of people that help support you. And so you can have medical doctors and naturopathic physicians and maybe a psychologist or body worker, whatever else it is that you need on your team to support you.
You mentioned malpractice insurance, and it just raises the topic of insurance. I want to thank people who have contributed their comments and questions on the various social media accounts for that expert show. Tracy, for example, on Instagram wants to know, is there any mainstream insurance that does cover naturopathy? Cheryl on Facebook says she knew nothing about this type of care until she sought help through her naturopathic doctor, and her insurance does cover her visit visits. What do you know about health insurance and its coverage of naturopathic remedies?
Well, it varies from state to state. I'm in Utah, and we definitely have some health insurance coverage here, and Oregon does as well. It really depends on the state that the person is in, which state. I think there are around 15 states around the country that do provide some sort of health insurance coverage for naturopathic medicine. So just need to check with your provider and find out more about that.
Interesting. And I think a great resource is also the American Association of Naturopathic Physicians, which helped us line up this interview. We'll include all the links to these different references that we're making in our tip sheet that we create based on the interview. There was another question that came in. This was via Oregon Live. Soul37 says, why do naturopaths sell remedies out of their own office, thus increasing their profits, especially when diagnosing new conditions means even more visits and selling more remedies? This is something that MDs usually aren't allowed to do because it creates an obvious conflict of interest. What would you say to that commenter?
Well, as a naturopathic physician that's been practicing for 20 years, I hear from my patients often. They want to know, where do I get this? Where do I get this supplement that you recommend? And I want to make sure I'm getting the right one. So it's a lot easier for naturopathic physicians to carry those in their clinics, so patients are sure that they get the right brand, they're getting the right potency, the right strength, because a vitamin C, for example, it comes in many different doses and forms, and the quality of products of supplements really varies. And unfortunately, the supplement industry is not as regulated as pharmaceuticals, and they're very different, and they don't need to be regulated the same. But it is important to be mindful of where you're getting your supplements, the quality of them, the purity of them. And so naturopathic physicians are extremely well trained in this, and we're really the best trained in natural medicine and naturopathic medicine. We really look at the purity, the quality, the potency, and only choose the highest quality brands. And oftentimes the brands that you find in a naturopathic physician's office, you wouldn't be able to find in a health food store, because these companies only sell to practitioners, because they understand that naturopathic physicians are trained in this area, and they want the naturopathic physicians to carry them. So if you just send someone to your local health food store, they're not going to be able to find those brands. So we're trying to make it easy for our patients and make sure that they get the right supplement.
Is there a limitation to naturopathic care? I mean, are there just certain things that naturopathic care, certain ailments that it really can't treat?
Well, absolutely. I'm not going to say that naturopathic medicine treats everything. I mean, if someone has, an emergency situation where they're in acute pain and they've been injured, they've had trauma, they need surgery, they need immediate medical attention, then certainly you're not going to go to your naturopathic doctor's office. You're going to go to the emergency room, and then maybe follow up with your naturopathic physician to get some extra nutrients to help you with the healing process. And then I think, whenever anyone is diagnosed with cancer, I think naturopathic medicine can be supportive, but it's important to work with an oncologist to make sure that you're getting your cancer treated properly. And again, naturopathic medicine can be very supportive in helping people with recovery and helping support the body. But yeah, when it comes to certain health conditions that are life-threatening, then certainly talk to your doctor and use a naturopathic physician as part of your team. And naturopathic physicians are trained to work with other doctors. We are trained to know when to refer out to specialists, endocrinologists, cardiologists, oncologists, whatever the necessary process is. Naturopathic physicians can be good for primary care for a lot of the common things that people experience on a day-to-day basis. And then we'll be able to refer out when certain issues arise that need additional medical care. So, and I do want to mention, though, it's important to understand where your naturopathic doctor received their training, because there are some states where naturopathic physicians are not licensed. So it's important to understand that in those states, anyone can call themselves a naturopath. So it's truly important to understand where the doctor got the training. The American Association of Naturopathic Physicians website that you mentioned, naturapathic.org, is a great resource for looking up naturopathic physicians in your area, understanding what to look for when you're looking for a naturopathic physician, helping you find a naturopathic doctor in your area. And in the state of Oregon, naturopathic physicians are licensed like they are in Utah, and like I was the first woman licensed in California as a naturopathic doctor. But as you can see, I'm not in my 80s. This isn't a medicine that's been licensure hasn't been around for many of these states for very long. So this is the thing where it does take a little bit of education. Understand who is in your state, where did they go to school, and ask and make sure that they went to one of the accredited 4-year naturopathic medical schools. Because if they did an online course, if they didn't do anything in person, then they didn't receive the same level of medical care. So when we go to naturopathic medical school, we are seeing patients, interacting with patients. We are, we get a very in-depth level of training so that we can diagnose and treat disease. And we do that with this more holistic approach and using the least invasive medicine possible to help support the body.
That is great advice. I appreciate that. You had mentioned, what naturopathic care is good for, and acute pain that, requires an emergency room may not be appropriate. But we have people tuning in and watching live on Facebook. I want to thank Kim Sanders, who's watching. And she's asking, what can she use for pain? And the way that she's phrasing that, I would have to think that she's talking about chronic pain.
Yeah, well, and certainly, when you have acute pain and a trauma or something, like I said, go visit your urgent care emergency room, get it immediate attention. But when it comes to chronic pain, there certainly is a lot that naturopathic medicine can do to help support the reducing pain and helping people avoid some of the very addictive pain medications out there, or also helping get people off pain medications and into a more natural approach. And certainly there's a lot, and that is a combination. And finding a naturopathic doctor to work with is going to be the best place to go, because it depends on where your pain is coming from, where your pain is. Why do you have the pain? Do you have a history of trauma, or what is the underlying cause of the pain? What's truly important with naturopathic medicine is getting to the root cause of the problem. When you find the root cause, it's so much easier to help support the body in healing when you address the root cause. So if it's inflammation, for example, could be one of the root causes. Making sure that you're doing an anti-inflammatory diet, that you're taking anti-inflammatory supplements, and also that you're getting some sort of body work that's appropriate for your current state of health. That maybe it's massage, maybe it's more deep tissue work. There are lots of different types of physical medicine that can help. There's also things like PRP or stem cells and those sorts of procedures that can be helpful in helping support people get through pain. And naturopathic physicians specializing in chronic pain can be particularly important to look for.
Interesting. What comes to mind, for example, is it turmeric? Turmeric.
Yeah.
That's a supplement that is so popular right now. You see it everywhere. It's good, I guess, at fighting inflammation, but I would have no idea how much to take, and taking too much can also be a bad thing.
Right, and that's why it's so great to work with a naturopathic physician, so that you're getting the right amount and you're getting the kind of the active component that's actually in turmeric. Because when we just take turmeric through maybe putting it on our food, it's not going to be enough to provide that therapeutic value for chronic pain. And also, there are only certain types that are truly bioavailable and absorbable that can create those beneficial anti-inflammatory and pain-reducing effects. And that same goes true with things like CBD, which CBD is very popular right now, but there's huge variety of quality and potency within hemp and CBD. So it's working with the naturopathic physicians a great way to ensure that you're getting the highest quality, and that if you're taking medications or other supplements, that they're not going to interact poorly with each other. I honestly, I don't always put people on more supplements. I have plenty of patients that have come in with bags of supplements, and I've gotten them off of all of them, but maybe two, and said, you really don't need all these supplements. In fact, you can sometimes be doing more harm than good if you take too many and you're taking poor quality supplements. So you want to make sure that it's the purity, the potency, and the right balance, the combination of how these interact. And pharmaceutical drugs do sometimes interact negatively with certain supplements. And so working with a naturopathic physician, we're some of the best trained in this area, because we have that understanding and training in both pharmacology and in nutritional supplements.
That is pretty fascinating, especially because whatever is going on in your gut, like you were talking earlier about gut-brain health, whatever your digestive system is like, you could be taking so much turmeric and your body's not even absorbing it based on what's going on in your stomach, right?
Absolutely. So many people have digestive problems, and even if you don't have symptoms like nausea or diarrhea or anything like that, you could still have a poor digestion and assimilation. And if that's not working well, you could be eating the healthiest diet on the planet, but you're not getting the nutrients from your food. So it is important to ensure that your digestion is working well, that your gut microbiome, all those good bacteria that are in your digestive tract, that balance of microorganisms, or is in the right balance to optimize digestion and assimilation of nutrients.
There was a commenter on the Oregonian's website, Racer Girl, wants to know what your opinion is of bioidentical hormones, pros and cons. I actually don't even know what she's talking about.
Well, bioidentical hormones are a type of treatment. It's a type of hormone therapy. And bioidentical hormones are made in a lab. They're made from natural substances in a lab to be biomolecularly the same as our own hormones. So they're designed to be a safer alternative to hormone replacement. So a while back, there was a Women's Health Initiative study that showed some negative outcomes for women doing hormone replacement therapy. And those studies were done with Premarin and synthetic hormones. And so the bioidentical hormones are designed to be a safer alternative because they are made to be molecularly the same as your own hormones. Now, just like anything, you want to make sure, if you're choosing to go the bioidentical hormone route, that you're working with someone that is really well trained in this. And naturopathic doctors are well trained in this, but look for someone that specializes in hormones, because they are going to be up to date on the current and the latest research on this and know how to safely and effectively use this in combination with other things that you're doing. And I think bioidentical hormones are something that I do in my practice, and I think they can be a really powerful tool, but they're not right for everyone. And certainly I wouldn't start anyone on bioidentical hormones until we've addressed the foundation of their health, like their gut health, and addressing things like inflammation or gut microbiome disturbances, nutritional deficiencies. So it's important to get that foundation in, and that bioidentical hormones, when used appropriately, can be a powerful tool.
You were bringing up earlier, obviously if you get a cancer diagnosis, you want somebody to go work with an oncologist. But there are other diseases that are quite serious, like diabetes or heart disease, high cholesterol, for example. Are these areas of health in which naturopathic medicine can make a difference?
Absolutely. Naturopathic physicians are trained as primary care doctors. So anything that a primary care doctor would treat, we are trained to be able to manage as well. So treating diabetes, especially type 2 diabetes, is something that a lot of naturopathic physicians can help with. Now, of course, someone with type 1 diabetes that needs insulin, they're certainly going to need to work with someone that a naturopathic physician or other doctor that can prescribe. So if you happen to be in a state that does not license naturopathic doctors, they're not going to be able to prescribe medications. Certainly, if a naturopathic physician feels that there is a patient they have that needs help and it's not well managed, then they would work with an endocrinologist or another specialist to help support the patient. And as far as cardiovascular health, it really depends on the severity. And we do work with other doctors. We refer to cardiologists for testing and making sure that the patient's on the right track. There are a lot of things that naturopathic medicine can do to support cardiovascular health and address heart disease. So working with a naturopathic physician can absolutely be beneficial. Again, there are naturopathic physicians that specialize in that area. So if that's what you have, then look for a naturopathic physician that has experience and perhaps even a specialty in one of these areas.
Okay, so I didn't know that. I didn't know that naturopathic physicians specialize in particular areas, but that totally makes sense. And I just want to clarify something you said there. So if you are in a state where naturopathic physicians are licensed, those physicians can prescribe medications like normal everyday pharmaceutical medications, and that is not the case if you live in a state where those physicians are not required to be licensed?
Yeah, let me clarify that. Thank you for asking, because I know it's kind of confusing. So in the states where naturopathic, and every state is different. Every state has their own laws and their own board or licensing board. And so in the states where we're licensed, there are prescriptions that are medications that naturopathic physicians can prescribe. Typically, there are limited compared to what a medical doctor could prescribe because they have more to do with primary care, right? Mm-hmm. So what you would typically see in primary care, like antibiotics, bioidentical hormones, thyroid medications, those sorts of things, insulin, epinephrine, those are kind of important for primary care. But in states where naturopathic doctors are not licensed, there's no license available, so you can't prescribe medications if you don't have a license. So in those states, naturopathic physicians cannot, unfortunately, at this time, prescribe medications. But they can do a lot of other support as far as helping with diet, lifestyle, supplements, and those sort of supportive treatments. And hopefully, before too long, the entire country will have, license available to naturopathic physicians. So then this won't become an issue, because it is very confusing to the public to know, if they're in a state where naturopathic doctors aren't licensed, and what scope of practice that they have. And unfortunately, in states that don't license naturopathic doctors, naturopathic doctors can't practice to their full training and the capacity that they're able to.
Fascinating. Okay. I wanted to thank some folks who are watching us live. Kenneth, Rhonda from Merrill and Victoria, thank you for tuning in live via Facebook. Any last thoughts that you want to leave us with? For those, it's very interesting. When I went to go post this, I guess I wasn't expecting responses that were so skeptical and so critical. But on the other end of the spectrum, people who were, all for naturopathic care and really believers in it. What would you say to the skeptics and those who are critical? Although I know you don't want to spend too much energy trying to convince people who simply aren't believers.
No, and I completely understand. I think a lot of times it's a lack of information that people have. I think it is confusing today. You can go online and there are so many people calling themselves health and wellness experts. So I think it's really great that people ask questions and that they're skeptical. If you're working with a practitioner, ask them where they got their medical training. And if they didn't receive any medical training, then it's important to realize that they have limited abilities with their ability to really truly understand how your body works. And if you have a disease state that needs to be addressed. And I want people to feel confident that naturopathic medical school is a very rigorous training, and that we are trained to be primary care doctors, that we're trained to diagnose and treat disease, that we get training in anatomy, physiology, pathology, pharmacology, all of this. And the thing is that we really want to help get to the root cause. What is the underlying cause of the person's ailments, or what could be keeping them from having optimal health? And then give the body the right tools to support it, and starting with diet and lifestyle and moving our way up. And when people are looking for a naturopathic physician, it's important to find someone that is the right fit for you. And so ask questions, find out about their training. Do they have a specialty? Not all naturopathic physicians specialize. In my practice, I specialize in naturopathic dermatology. I focus more on the skin. But look at that person's experience and find someone that you feel comfortable with. And some naturopathic physicians are going to be focusing more on the pain or different aspects that are going to be best for you. And realize too that there is research unfolding all the time in support of the modalities that we use, in support of various nutrients and herbs, and that as naturopathic physicians, we're always trying to stay on the, on top of the research and seeing this and seeing the trends and being involved in the research and promoting it. It does require a lot of money to do research. So, and a lot of times that money can come from pharmaceutical companies. So it can be a little bit more challenging for naturopathic medicine. Sometimes that's one of the reasons why it gets a bad rap. But believe me, we love research. We love to see the research. We also know the power of the healing traditions over the centuries, and that we have seen it support the body for many centuries, and certain food as medicine and certain herbs and nutrients. And so we combine the best of both worlds. We combine the best of traditional medicine as well as research and science-based medicine, so that we can be truly cutting edge and help our patients the most. And I understand it. What led me to become interested in it is my own health issues as a child. And conventional medicine wasn't providing the solutions for me. And I was just having adverse reactions, allergic reactions to all the medications I was put on. And the more naturopathic approach is what turned my health around. So sometimes people just have to experience for themselves. And when you do experience it for yourself, there's really no going back.
I hear you on that. Well, thank you so much for taking the time to share your insight and your wisdom with us. I really appreciate it. And I encourage people to check out your information. We'll link to all of your sites in the post that we create from this.
Thank you so much.
And thank you for joining me for this episode of That Expert Show. I hope you found it helpful. You can always go back and watch previous episodes of our show on thatexpertshow.com. You can also watch the YouTube channel, which we list all of our previous episodes on there as well. And you can listen to us as a podcast. We kick this all back out to you on Apple iTunes, Google Play, Stitcher, TuneIn, Spotify, all those good places. In between shows, connect with us on our social media. I'm on Facebook at Anna Canzano. Twitter and Instagram at Anna Canzano as well. I would love to hear from you, your feedback, your ideas for future topics and guests that you want me to interview. If you get a chance, throw in a review there on iTunes or wherever it is that you're seeing this, or give us a like. It helps others find us. But I really love the conversation that I have with you and the conversation that we have with all these great experts. It's called That Expert Show, where you help run the show.